Assalamualaikum warahmatullahi wabarakatuh. My name is Izzati Binti Halim, and I am the representative of group number 2, which is we're going to talk about the third sustainable development goal, which is good health and well-being. Good health and well-being is one of the 17 sustainable development goals established by the United Nations in 2015. The official wording is to ensure healthy lives and to promote well-being for all at all ages. So now I'm going to talk about the first target to achieve the third sustainable development goal, which is to reduce maternal mortality. So, do you know about maternal mortality? Maternal mortality or maternal deaths is defined by the World Health Organization as the death of a woman while pregnant or within 42 days termination of pregnancy. For more information, the World Health Organization has reported that 830 women from all over the world die each day from complications of pregnancy or childbirth. And in Malaysia, the World Health Organization also reported that 26,000 women died due to the maternal mortality. According to a study published in The Lancet, which covered 1990 to 2013, the most common causes of maternal mortality are postpartum bleeding, complications from unsafe abortion, hypertensive disorders of pregnancy, postpartum infections, and obstructed labor. The unequal status of women and girls, lack of making decision power, knowledge, and finances remain underlying causes for the inability or delay in seeking health care, which end up increasing maternal mortality rates. In order to reduce maternal mortality rates in Malaysia, we need political commitment to strengthen the health systems. According to United Nations Population Fund, UNFPA, 4 elements are essential to prevent maternal death. Firstly, prenatal care. It is recommended that expectant mothers receive at least 4 antenatal visits to check and monitor the health of mother and fetus. Secondly, skilled birth attendants with emergency backup such as doctors, nurses, and midwives who have the skills to manage normal delivery, emergency obstetric care to address the major causes of maternal death, and lastly, postnatal care, which is the 6 weeks following delivery. Therefore, follow-up visits by a health worker to assess the health of both mother and child in the postnatal period is strongly recommended.
Assalamualaikum and hello everyone. It's my pleasure to introduce myself. I am Nadiah, and in this video I would like to share about the topic under the Sustainable Development Goals, which is good health and well-being. So one of the targets is fight communicable disease. What is communicable disease? Communicable disease means an illness caused by infectious agent or its toxins that occur to the direct or indirect transmission of the infectious agent. The Disease Control Division of the Ministry of Health Malaysia has listed 47 communicable diseases in Malaysia. The list of top 5 communicable diseases in Malaysia is dengue fever, tuberculosis, hand, foot and mouth disease, food poisoning, and the last one is viral hepatitis. So what kind of methods that we can do to preventing the spreading infectious diseases in Malaysia? Here I will share 5 ways that we can practice in our daily life. The first one is wash your hand often. This is especially important before and after preparing food, before eating and after using the toilet. The second is get vaccinated. Immunization can drastically reduce your chances of contracting many diseases. Keep your recommended vaccinations up to date. Third is practice safer sex. Use condoms, get tested for sexually transmitted diseases (STDs), and have your partner get tested or abstain altogether. The fourth is don't share personal items. Use your own toothbrush, comb or razor blade. Avoid sharing drinking glasses or dining utensils. And the last one is keep your environment clean and free from insect repellent. Dispose of empty cans and bottles that are breeding grounds for mosquitoes. With a little common sense and the proper precautions, you can avoid infectious diseases and avoid spreading them.
Hello, my name is Siti Muslihah Husna Binti Mohamad. So, I will explain the next target for the goal good health and well-being. The next target is to reduce mortality from non-communicable diseases. Cardiovascular disease, diabetes, cancer, and chronic respiratory diseases are known as non-communicable diseases. The fact is, every 2 seconds, someone aged 30 to 70 years dies prematurely from this non-communicable disease. These diseases have increased as a result of population aging, urbanization, globalization, and changed lifestyles, and they may become a great epidemic of our age. Non-communicable disease can largely be prevented by adopting a healthy lifestyle, but to do so requires more disciplined determination. For example, many of us enjoy eating fast food and doing vaping activities because the advertising of these products seem to be all around us. Malaysia needs to limit the advertising of fast food and vaping products. We are lucky because our government had provided access to health service for the population, including access to early detection disease, diagnosis, medicine, and treatment without discrimination and without undue financial hardship. So, we as the citizen should grab this chance and doing health checkup regularly. This way, all together will help us to stop this terrible epidemic from getting worse and let us to have a productive life. So, the conclusion is, healthy public policies and healthy lifestyle are the prescriptions to prevent all non-communicable disease. That's all from me. Thank you.
We were given skills to drive, not to hurt others or even ourselves.
Road traffic accidents has seen a lot of increase in present times. Approximately 1.35 million people die each year as a cause of these road traffic crashes. More than half of all traffic deaths are among vulnerable traffic users, which is cyclists, pedestrians, and motorcyclists. So, in order to achieve the third SDG target on reducing road injuries and death, here I got some tips. First thing we gotta do is reduce speed. Never go for a very high speed, especially when you don't really used to that road. And of course, take note on the speed limit. Second, wear your seatbelt. When sitting in the car, wear your seatbelt. You're on motorcycle, wear your helmet, and it will reduce the risk of head injuries. Third, avoid distraction when driving. The biggest distraction we're facing right now is handphone. Driver likely to react slower within surroundings whenever texting or making calls. Thus, when we need to use the handphone, it is better for us to stop at the side of the road. Fourth, make a quick check. It is good to make sure our car is in the best condition before starting the journey. Making a quick check is just as simple as checking the oil engine, checking the brake, and check on the tires and also lights of your car. Hopefully, being responsible towards ourselves on the road will help in reducing the number of traffic deaths. Hashtag kita jaga kita.
Assalamualaikum warahmatullahi wabarakatuh. I would like to explain about Sustainable Development Goals number 3, Health and Well-being. SDG 3 aspires to ensure health and well-being for all. One of the targets is achieving universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. In this video, I would like to highlight about essential medicines and vaccines. Recently, we are living in the era of pandemic COVID-19 and everyone has been affected by it. Recently, the government has signed an agreement with Pfizer BioNTech to supply COVID-19 vaccines, and Malaysian government give it for free to Malaysian citizenships. The government cover all the cost of these vaccines. To reduce the cost of the vaccines, Malaysia should collaborate with the scientists from other countries to develop vaccines in this country. If Malaysia can produce our own vaccines, all the Malaysians can get it easily, and at the same time, we can export it to the countries nearby.
To make sure that all Malaysians are vaccinated, the healthcare officers must go and reach them, especially those who stay in rural areas such as Orang Asli village in the interior of Sabah and Sarawak. The healthcare officers need to stay in the village because it is hard for all of them to reach the healthcare facilities just to take the vaccines. All of them should be vaccinated because they also have rights to get essential healthcare services.
Even though the vaccine for this disease has been invented, the halal status of the vaccine worries Muslims in Malaysia. So, the government should provide solutions regarding these issues by stating the fatwa from muftis about COVID-19 vaccine and spread it through social media. They should be ready with strong and enough evidences to fight with rumors and fake news spreaded by anti-vaccine society. In a nutshell, these ideas can be applied to achieve the universal health coverage in Malaysia.
We hope this video will encourage all of us to make this world a better place. Thanks for watching!